Hello. On behalf of all of us at myseniorventure.com, we want to thank you for taking some of your time to learn more about the important topic of Medicare. You may already know there's a great deal of Medicare information to understand before you make important health insurance decisions which will impact your coverage and your care over the years to come. For your convenience, you will have the option to watch our Medicare educational presentation in its entirety or in individual shorter segments. Each segment has been specifically designed to answer the most common questions being asked by those turning age 65, as well as those who are past age 65 and are now getting ready to retire and will soon be leaving their current health insurance behind for Medicare insurance. Either way, after watching the presentation, you will be better prepared to make more confident Medicare decisions. We hope you will enjoy the information, and again, thank you for visiting myseniorventure.com.
These are the most commonly asked Medicare questions. What is Medicare? How does someone qualify for Medicare? Is Medicare automatic? How much does Medicare cost? Am I required to take Medicare? Can someone have Medicare and a health savings account or HSA? What does Medicare cover? How does someone fill in the gaps that original Medicare leaves you with? What are the differences between Medicare Supplement with a Part D and Medicare Advantage plans? When can someone enroll in a Medicare Supplement or Medicare Advantage plan? And how does the Part D coverage gap or donut hole work? So what is Medicare? Often referred to as original Medicare. Part A is hospital coverage and Part B is medical coverage. These are government issued and it would show Part A and Part B on your original Medicare card. Part C is the Medicare Advantage program and Part D is the prescription drug program. These are administered by insurance companies. So that's the answer to the question, what is Medicare? So how does someone qualify for Medicare? Well, the first and most obvious way, you turn 65. Also, people who have been disabled for 24 consecutive months can qualify for Medicare, and people with end-stage renal disease. That means kidney failure. If you've ever known somebody who's been on dialysis, most likely it's because they had kidney failure and they're qualified for Medicare. Is Medicare automatic? If you're receiving Social Security benefits prior to age 65, you'll be automatically enrolled in Medicare. You don't have to do anything. Your Medicare card will show up about 90 days before your 65th birthday. Your effective date will be the first day of the month that you turn 65. Unless, of course, your birthday actually falls on the first day of a month, then your effective date will be the first day of the prior month. If you're not receiving Social Security benefits, you need to proactively contact the Social Security office to enroll in Medicare. You can do it online at www.ssa.gov or call their national line at 1-800-772-1213. You can even walk in the local office and they can take care of it that way. How much does Medicare cost? Let's tackle the two parts to Medicare. Remember, Part A is your hospital coverage, and most people will not pay a premium for Part A. There's a reason for that. You've been paying taxes your whole working career, and if you've worked at least 40 quarters in your lifetime or had a spouse that worked at least 40 quarters, you will not pay a premium for Part A. Part B, on the other hand, does have a standard rate or a standard premium that you will be assessed. Most people will pay that standard rate, and it's the same regardless of where you live and regardless of your age. However, there can be adjustments for high-income earners. There's a benchmark that the federal government establishes. The benchmark for single folks is $85,000 adjusted gross income. The benchmark for couples is $170,000 adjusted gross income. If your income is above those numbers, you will pay more. That number can be adjusted each year based on your tax return. It will be a 2-year look back. They'll look at your tax return from 2 years prior, and then they're going to look at it each and every year going forward. Medicare beneficiaries who are low-income earners potentially may not have a monthly premium for their Part B. So that's the information on how much does Medicare cost. Am I required to enroll in Medicare? Well, the short answer is no. Medicare Part B is voluntary. However, The long answer is if you decline Part B, you may be subject to a 10% penalty for each year you fail to apply. For example, if you went 1 year without Part B, and if the premium for Part B was $104.90, your 10% penalty would be $10.49. Now the bad news is you would pay that penalty every month for the rest of your life. This penalty can be adjusted as Medicare Part B premiums adjust. Now here's an important exception to keep in mind. If you are actively working and covered by your health insurance, or if your spouse is actively working and you're covered through their group health insurance, you would not have that Part B penalty. Now here's the caveat you need to keep in mind. If you get to the end of your working career and choose to go on COBRA while Medicare eligible, you should enroll in Medicare Part B. Otherwise, you'll be subject to that penalty. Also, if you're on a retiree health plan when Medicare eligible, you should also enroll in Medicare Part B or potentially subject to that penalty down the road. So that's the answer to your question. Do I need to enroll in Medicare? Can someone have Medicare and a health savings account, or HSA? This question applies to many folks that are still in the workforce and have a health savings account attached to their high deductible health plan. These are very common in the workforce. Now the important question and answer for you is no, you cannot contribute to your HSA funding if you have Medicare. The funds that you already have accumulated, certainly they're yours to keep and you can use those in the future, but you cannot continue to contribute to that HSA if you're on Medicare. What does Medicare cover? Let's start with Medicare Part A. Remember, that's the hospital insurance. Medicare Part A covers inpatient care in hospitals, skilled nursing facilities, hospice care, and home health care. Part A does have some gaps, such as hospital deductibles, co-pays, and co-insurance. If you're in the hospital more than 60 days, you'll have daily co-pays. Medicare also has a lifetime reserve amount from days 90 to 150. You only get those one time. Next, let's look at the skilled nursing benefits. You pay nothing for the first 20 days of a benefit period in a skilled nursing facility. If you're there longer than 20 days, you're responsible for a daily copay. If you're there longer than 100 days, you're responsible for all costs. Next, let's tackle Medicare Part B. This is the medical insurance, which covers doctor services, outpatient care, labs and x-rays, physical, occupational, and chemotherapy. There are certainly gaps with Medicare Part B, such as annual deductibles and 20% of the cost of the Medicare fee schedule. Now, there's no limit to your financial responsibility with Original Medicare. In addition, there are even more gaps not covered by Medicare. Care outside the United States, dental services, nursing home expenses, excess doctor charges, routine vision care, glasses and contacts, as well as hearing aids. As you can see, there are gaps in Medicare. In the next section, we'll explain how you will fill those gaps. So how does someone fill the gaps Original Medicare leaves you with? Let's start with Medicare supplement plans. Many people call them Medigap policies. They come in letters, plans A through N. Also Medicare Advantage plans. These come in different sizes and shapes and colors, such as HMOs, preferred provider organizations, private fee-for-service plans, and special needs plans. They can be purchased with or without drug coverage. And lastly, we have Medicare Part D plans. Okay, so what are the differences between Medicare Advantage plans and Medicare Supplement or Medigap policies? These plans pay secondary to Medicare by filling the gaps such as deductibles, copays, and coinsurance. They're subject to Medicare's exclusions and restrictions. However, you're not confined to a specific network of providers, but they do not include prescription drug coverage. Medicare supplement policies were standardized back in 1992, and they've had a few changes since then, the last one coming in June of 2010. The current plans available are plans A through N. Companies may choose to offer some or all of those plans. Plans are offered by private insurance companies. You must have Medicare Parts A and B to enroll. Next, let's talk about Medicare Advantage plans. These are offered by private insurance companies. They're highly regulated by Medicare. Now, the medical benefits, the claims, etc. are paid for and handled by the private insurance company instead of Medicare. However, you're still in the Medicare program when you join. You must have Medicare Parts A and B. You'll receive a combination of benefits packaged into one policy. It will include hospital and outpatient, doctor services, prescription drug coverage, and many extras. So the plan benefits, provider networks, and prices change and vary from company to company each year. So that's the difference between Medigap and Medicare Advantage plans. So when can someone enroll in a Medicare supplement or Medicare Advantage plan? Let's start with the Medicare supplements. They have no specific enrollment window. However, you must be enrolled in Medicare Parts A and B. There's a guarantee issue window in the first 6 months of your Part B effective date. If you are past that first 6 months and applying for a Medicare supplement, you may be subject to health underwriting questions. When can someone enroll in a Medicare Advantage or Medicare Part D plan? There's really 3 windows of time. The first one is as you're turning 65, and it's called your initial election period. Medicare gives you a 7-month window to make those decisions. The next window of time is called the annual election period. That's the time period to join or switch plans. It's available every year from October 15th to December 7th. You can make changes, and those changes become effective on January 1st. And finally, there's what's called a special election period, and it's available for those who have a qualifying event. It lasts for 63 days from that qualifying event. Okay, so what are the specific requirements for enrolling in a Medicare Advantage plan or Medicare Part D plan? Let's start with the Medicare Advantage plan. You must live in the service area provided by that insurance company. Number 2, you cannot have end-stage renal disease. Next, you need to have Medicare Parts A and B. And finally, you need to have an election period. To enroll in a Medicare prescription drug plan, you must live in the service area provided by the insurance company, must have Medicare Parts A and or Part B, and need to have an election period. So how does the Part D coverage gap or donut hole work? Well, there are 4 phases to the prescription drug program offered by insurance companies. The first phase is the deductible period. Some of the plans that are offered do have a deductible, and if you have a plan that has a deductible, that just simply means that you'll pay 100% of the cost of your medications until that deductible period has been met. If you have met that, or if your plan does not have a deductible, then you'll go into the initial phase. In the initial phase, you'll pay co-pays and co-insurance until the total cost of the drugs reach the pre-designated amount established by Medicare. Once that pre-designated amount has been met, then you'll move into the next phase, which is called the coverage gap or donut hole. In this phase, your copays will be replaced with discounted amounts until the total amount of out-of-pocket expenses for the whole year reach the final benchmark established by Medicare. And finally, we've arrived at the catastrophic phase, our 4th in the 4 phases. When someone arrives at this phase, it means that you have reached the final pre-designated benchmark established by Medicare, which counts your individual out-of-pocket expenses. In the catastrophic phase, your discounted amounts are replaced and reduced by small copays and coinsurance. This will continue until the end of that calendar year, and then January 1, drug plans start over. So that's it. Medicare Part D with its 4 phases, including the coverage gap or donut hole.